there's a lot of deficiencies and also health habits that are involved in a daily basis that also increase our risk of lots of health problems, including stroke. So one of those things that many Americans they're deficient in would be your omega-3 fatty acids. There are a lot of studies out there showing that those who are lower in the omega-3 fatty acids, are the essential fatty acids, that they are deficient in them and increases your risk of inflammatory conditions, yes, in your heart, but also all over the body, including your brain, including increasing your risk of having a stroke. There are other people that are B12 deficient or vitamin D deficient. And you can test these things easily. You can test for your omega-3 fatty acids, and you can test for your B12, and you can also test for your vitamin D. And every single one of these have multiple studies showing that there is a connection between these deficiencies, and having a stroke. Why wouldn't we do these on a regular basis and at least see if these are okay? You may have had your vitamin D levels tested, but have you had your omega-3s tested? And if you've had your omega-3s tested, well, you should make sure that your omega-6s are tested, which are more than pro-inflammatory oils. So, there's lots of, also from a sedentary lifestyle, that's been well recognized for a period of time, that those who are more sedentary tend to have an increased amount of cardiovascular disease, including stroke as well. There's lots of things that we can do on a regular basis to help mitigate and reduce our risk of having a stroke, but you can also test for these things. That's the problem with a lot of standardized testing now. If you go in for any kind of a health fair, you might be able to actually request to have your vitamin D levels tested. And sometimes you can have your B12 levels tested too. But most people are not having their omega-3 levels tested. And when you look at that statistic, that 80% of all strokes are preventable, these simple, easy tests, why wouldn't you want to do that?